Welcome to this video on antibiotics and painkillers. We'll explore how these medicines work, why they matter, and the critical issue of antibiotic resistance. Medicines are essential for managing health, but not all work the same way. Antibiotics target bacteria, while painkillers are used to manage discomfort. Antibiotics are a vital medical discovery. They work by either destroying bacteria or stopping them from reproducing, effectively treating many previously deadly infections. Antibiotics target unique bacterial processes without harming human cells. They can be bactericidal, killing bacteria outright, or bacteriostatic, inhibiting reproduction so the immune system can finish the job. It is crucial to remember that antibiotics only work on bacteria, not viruses. They are ineffective against common viral illnesses like the flu or COVID-19. Because different bacteria have different structures, no single antibiotic works for everything. Doctors must identify the specific infection before prescribing the right treatment. Treatment can involve narrow-spectrum antibiotics for known pathogens or broad-spectrum ones when a diagnosis is needed quickly. Labs also perform sensitivity testing to ensure the best choice. Always finish a full course of antibiotics as prescribed. Stopping early allows surviving, potentially resistant bacteria to persist, which drives the development of resistance. Antibiotic resistance is driven by natural selection. When antibiotics are misused or overused, we create an environment where resistant strains can thrive and dominate. Resistance is a massive problem. It leads to infections that are difficult to treat, longer hospital stays, and an increasing global death toll, making it a priority for health organizations. The WHO has officially declared antibiotic resistance a global health emergency. It requires urgent cooperation across all sectors of society. Several factors fuel this crisis: failing to finish courses, overprescribing for viral infections, agricultural overuse in livestock, and poor hygiene practices in healthcare settings. MRSA is a well-known example of resistance. It highlights the dangers posed in hospitals and emphasizes the need for strict hygiene and careful prescribing. Scientists are working hard to develop new antibiotics. However, this research is incredibly complex, time-consuming, and expensive to conduct. Development faces hurdles. It takes years of testing, carries low commercial incentives for pharmaceutical companies, and bacteria quickly evolve to resist even new drugs. So how can we slow down antibiotic resistance? It requires coordinated effort from everyone, including patients completing their courses, and governments enforcing better regulations in farming and healthcare. While antibiotics treat infections, we often rely on painkillers or analgesics to manage symptoms like pain and fever. It is important to remember that these medicines do not treat the underlying cause of illness. Painkillers work by interfering with pain signals in the body. Common types include paracetamol, ibuprofen, aspirin, and prescription-only opioids, each suited to different levels and types of pain. Remember this key distinction for your exams. Painkillers do not kill pathogens like bacteria or viruses. They strictly manage the sensation of pain, while the body or other treatments fight the infection. This chart highlights the differences. Antibiotics target the bacterial cause and can kill it, whereas painkillers target pain signals and have no effect on pathogens at all. Even though they don't cure infections, painkillers remain vital for recovery. By reducing discomfort, they help patients rest and regain strength, which supports the body's natural healing. Painkillers play a crucial role in patient care. By managing pain, they improve rest, help maintain nutrition, boost overall quality of life, and can even make essential medical treatments possible. Before any medicine reaches a patient, it undergoes a rigorous testing process to ensure it is both safe and effective. This process can take many years to complete. Medicines are tested for 4 main reasons: to prove safety, demonstrate efficacy, determine the correct, non-toxic dosage, and ensure stability and consistency in manufacturing. The testing journey moves from preclinical lab and animal studies to 3 phases of human trials, ensuring we identify potential problems before the medicine is widely distributed. Clinical trials involve human volunteers and follow strict ethical guidelines. They measure safety, effectiveness, side effects, and optimal dosing to confirm the drug is ready for general use. To ensure reliable results, trials often use placebos, dummy treatments, and double-blind methods where neither the patient nor the doctor knows who is getting the real medicine. This removes bias. Once trials are successful, regulators like the MHRA or FDA conduct a final, independent review of all the data. Only then is a medicine approved for pharmacy use. In summary, a medicine's journey from initial discovery in a lab through rigorous testing phases and, finally, to regulatory approval is a long and highly controlled process. To conclude this video, here's a quick guide to the key terms we have discussed. from the definition of antibiotics and painkillers to the specifics of how clinical trials work. Let's review some common exam mistakes to avoid. A frequent error is stating that antibiotics kill viruses. They only work against bacteria. Additionally, remember that painkillers only relieve symptoms like pain. They do not cure the infection itself. Finally, antibiotic resistance develops in the bacteria, not the patient. For your exams, keep this tip in mind. Antibiotics are for bacteria, not viruses. If a question describes a viral condition like the flu or a cold, do not suggest prescribing antibiotics. This chart is a helpful quick check guide to distinguish between infections caused by bacteria and those caused by viruses. Remember, painkillers only treat the symptoms. If you are asked how an infection is treated in an exam, focus on the immune system or antibiotics, not painkillers. Here are some practice questions to test your knowledge. Consider why antibiotics are used for bacterial infections, why completing a course is vital, and how double-blind trials function. These model answers provide the key points you should aim for. Ensure your answers mention that antibiotics kill the cause, finishing courses prevents resistance, and double-blind trials eliminate bias. Consider the real-world impact of antibiotic resistance. Current data shows high death rates, which are projected to grow significantly by 2050 if left unchecked. To summarize, antibiotics kill bacteria, not viruses. Resistance is a global problem. Painkillers treat symptoms, not pathogens. And all medicines require rigorous clinical testing for safety. Use this checklist to ensure you are confident in all the topics covered, from the function of medicines to the details of clinical trials. You're well prepared for your exams. Remember the core distinctions: antibiotics for bacteria and painkillers for symptoms. Good luck with your revision.